This is Weifeng speaking. I'm a microsurgery teacher at University of Wisconsin Madison. Today, Paula come back for the second lesson. Tuesday we practice basic lesson, the microsurgery intro. We walk through the microscope and more basic knowledge and practice some basic skill. So today we move forward to do some anastomosis. So the end-to-end anastomosis can be very useful and can cover almost like 90% of the anastomosis in the clinical practice. So that will be our first lesson. Paula, welcome back. Paula, she's PGY 4 ENT resident, and she's planning to apply for the micro fellow in the upcoming year. So a basic, the microsurgical skill, you'll be laying a good foundation for her to thrive in the fellow year. So we will talk about so here, let's go over a little bit. The blood vessel. Jane, please put the camera to the live streaming camera. Scene. Upper left corner. Okay, now let's talk about the method. So end-to-end anastomosis, that's the most common method. And microsurgery try to use the single method to get a job instead of try a hard method. It's not necessary in the lab. We try as hard as we can. We overtrain ourselves in the OR. Use the KISS method. Keep it simple and stupid.
Well, it's not simple, but simpler, I'd say.
Yeah, so end-to-end anastomosis. There's only two methods for end-to-end. First method is through suture, and then divide to front wall and back wall. And then after that, we finish the front wall, add one suture, and after divide to half, and three more in between. And then flip it, and then the back wall becomes the front wall again. So this is the most simple method. And there's some variation. This is the method Tuesday. Because usually we put a clamp on here, and then some of the clamp they have a frame. They have a frame, so that you can attach this suture on the frame. So this suture can stay on the frame. So it's kind of this two is the two-stay suture. So they name it two-stay method. And the second method, there's some variation. Like when some of them they take it like 3 suture. So 120 degrees dividing And so you don't need to turn 180.
Oh.
You can just turn like 120 and then you can see the others. That's a little bit easier. And also, if the vessel was small, the assistant can hold it as the back wall, pull the back wall away to reduce the risk of hitting the back.
Oh.
Yeah, but most of the time, bigger vessel, you just use this regular method.
It's for smaller vessels with this, there's less risk of back wall, like
Yeah.
back wall.
So another method is in the situation like if there's a branch holding the vessel here or too much tension, it cannot flip it. In that situation, we have to do the back wall first. So the first stitch will be away from us, and then go here, and then go here, and then finish the back wall, and then go here. It's the method is coming from the bottom to the tops. So this method is one way up method. One way up from the back wall to the front wall. So this is method mostly maybe 5% of the time you have to use this method.
When you tie though, using this method, does your knot become inside the vessel?
No.
Oh, okay.
Yeah, that's something a little bit different of this method. How we pierce the vessel. We pierce from outside in, and then inside out, and tighten up from outside.
Oh, I see.
And there's a little bit different of the way we holding the needle. We holding the needle like usually the needle is. Now in this situation, we holding the needle is pointing
The other way.
the backhand technique. So the method is almost the same, just a little bit different in holding the needle and the sequence of placing the sutures. And in this method, there's also a variation. Dr. Sieber, you know Dr. Sieber? John Sieber.
Oh.
He just retired.
Oh,
in the plastic surgery.
No.
So when we're talking about this method, he said, how I start from the middle and then go two-way up.
Oh.
And then I try this method. Oh, it's clear, it's easier than this method. The thing about this method, the second stitch will hiding way inside the corner. In this method, the second suture is a little bit outside.
Oh.
So it's easier to go to approach to that. So this is a two-way up. Actually, I like this method. How better than this method? So it's good to have a senior professor. So they have a lot of experience. So we will practice this method first. And then there's a different method of placing the stitch. Like this is like we put interrupt suture one after one. And there's also like the open loop method. We place the suture interrupt neither continue style, and then we cut it and then tie knot one by one for the interrupt. Become an interrupt.
So you need the loop, and then you cut it, and then you have the loops, and then you just go out and everything. Oh, I see.
Yeah. Have you seen that?
I think I've seen the video in the last micro course we had last year, and I remember from the video, but I've never seen anybody doing it.
Yeah, it's one of the methods I use. Kind of. We will explain it later. That's one of the favorite methods I like. Okay, now let's use the practice the method. Okay, yeah, that's it. So like this one is very close. That actually is not very good. So we want the vessel stay a little bit away from each other. The distance is like one third of the is the diameter of the vessel. Yeah, so that will making us easier to see the movement. And there's not much tension in between the two. Now I will let you try to just put one stitch and then I will show you some tips. Yeah, use this and yes. Now you can try this one also. Yeah. Is that the teeth or no teeth?
No, there's no teeth.
No
The
teeth,
teeth
okay.
back.
Left handy?
No, I'm right-handed, so I feel like I have the wrong.
Oh.
I forgot everything already. See?
No, it's just decoding it from your mind.
We had it like that last time, but I feel like it's not.
Yeah, perpendicular to the river.
That's
Uh, yeah, the curve of the needle holder is on the other side. Yeah.
oh. Oh, okay.
Yeah.
Okay.
Yeah, you can try as far as you can go to the left.
Easier said than done.
Rest your hand on the paper by writing.
Oh yeah.
About how you know, holder go out. Yeah. Bring it back in front of you.
See, I have to practice more because I seem to have forgotten everything.
Yeah, it's like learning riding bicycle. You need to train until you find you can balance the bicycle, and then we will never forget. Okay, now because the knot is not you see that's not a flat knot, so it's a stiff knot. So if you want to tie a good knot, you need to cross the
Because I
suture.
didn't.
Yeah.
Because I probably didn't change my hand.
Yeah.
And I think I might have.
Or you can like start
I
by
think I might have broken the middle of the suture. No.
So in here we tie the knot. So remember when we after we pull the suture out, bring it back to in front of you. Okay. Let's start by a little holder for this long end. Okay. And I will release this now for
Okay.
you and try.
Much better.
Yeah, so relate the that kind of awareness. It's very important for the first time, so we can secure the first touch. Okay, keep going.
Then I have to. Yeah, that's not the best. See, it's like
Yeah, it's not after
we're gonna.
yeah, so
Oh, that's so much better.
some of the instruments you can see they make it like the forceps actually is not functioning very well. This one is that was some
This one.
yeah I can go fitness on so I can use it to help.
I'm like hiding myself. I have to cross my hand, which is not great. I have to type. I have to type this a little better.
Yeah, so when you get closer, so that's so
Is it tight?
it's fine. Yeah, practice. I will show you how to address this if that happens. Yeah, so now I am not this one.
Not the best.
Yeah, or like yeah. Hold on, like this suture is behind your needle holder. That's why we feel required to remove. Bring it back in front of you. Check the suture. Yeah, now the suture is in front of the needle holder.
Oh.
Okay.
What? I think I iron it a little bit inside.
Yeah, it doesn't matter. The first it's the first anesthesia.
Yeah.
You can do it. That's the goal. Is a perfect one. Okay, now Stitching method I want to share with you in microsurgery is like think about when we're doing regular stitching, like we stitch the skin, we raise the skin and then we turn our wrist, right?
Yeah.
We do the stitching method. But under the microscope, when we hold the needle holder like this one, like this way, if we still like to turn the needle, that's when it's not convenient. And also when we want to come out, we want to bring the needle out, and we try to kill the needle, because the needle is just like 100 micron. It's very easy to bend the needle when we try to press it.
Rotate, thank you.
Yeah, when we rotate and kill the needle, I bend the needle again and again at my very beginning of practice. But slowly I getting better. I never bend the needle again. But I don't know what has been changing in my hand. As I said, you I teach and then I compare to what I'm doing and what the student doing. So actually we use a very simple method. Is I would like to say it's moving forward. So all the needle need to do just move forward, just move forward. So it will become make it nice and easy. Like the point is like raise the edge by the forceps. And we'll see what I do. Press down.
Then move
Then
forward.
we press down the edge raise and the PS point going down. Then we create a difference, a high difference between here and there. See, and then what we do is just do this way. So we don't need to like in here. If we didn't do that motion, we need to turn. When we turn, you will feel wow, a lot of muscle need to do together.
Yeah.
That's the Droney or supine muscle and finger muscle. But this use this one, we just need to move forward. And on this side, keep try not to try to catch it. See if I go down and then try to catch the
You're
front
gonna
wall.
back wall it.
Yeah, they're very high risk of hitting the back wall. So we keep the needle in the air and then we pick up the front wall and then put it on the tip. That's 100% sure. There's only front wall on the needle tip, right? And then press the distal down and move forward again. And then take the needle. When we take the needle, see if I still hold the needle like this way before I can close the needle. Hold it. 1 hour already hit it away, like this one hit it away. So we turn the needle holder, we match the curve. Then we turn it. That's on the left side. Other than that, just take maps. You already very good at that. Okay, bring it back in front of me. And I let go the needle. Look. So we can adjust a little bit, see, making it match very good, and then tie it down.
Oh, that's a beautiful knot.
Yeah, I think about it, if we have to cross the suture, we don't have the capacity of adjusting the edge very well, right? But with this method, we don't need to cross our hand, so we can have some capacity of adjust the edge, make it match very well. Yeah, so the second knot, if we don't want to cross, we can go it up and down. Up and down also can compensate some of the yeah, the direction. And then third knot just left to right. That's I didn't pass the suture. In most of the time, I don't pass the suture. But that's the way of doing surgery. In training, train both of your hands until you feel very comfortable. Of both hands. Okay. Yeah. And when we getting better, we will practice something even better. This one is airborne method. Control the short hand. Control the short hand. Just
wow.
so we just don't need to let the short hand go.
This It's amazing.
Yeah, so this is when the resident they see this method and then they practice method. They said, "Oh, it will become my only method of tying mask." Yeah. And when in a very difficult situation, if you're working in a very deep space, uh, we
That is awesome.
yeah, we are considering if we lose the short end, it's a really hard to pick up, even with the assistance help. So this method is like 100%. We can control both of the long end and short end. Not smooth, but it's very efficient in a very difficult situation. Like for example, you're working in a very deep space, like in the oral cavity.
Mhm.
Once you lose this suture, it may hide behind a vessel or behind a clamp. So if you catch both of them, you don't have to worry about that.
That's
So
really
usually
cool.
we have 4 methods. I teach 4 methods. Okay, cut the suture. Yeah, looks like the scissor is pretty good. Now go back to the needle. Now we didn't see the needle, and we just pull the suture and then we'll come back. Okay, now your turn. Okay, add 2 more. Yeah, 2 arm, put 2 arm inside. That is also good. That's good. I have step down. Nice. Yeah. See, nice and easy.
And then you said push it away.
Yeah, push it all the way as far as you can. I mean, then don't let the needle go until we push all the way to the other side. Start at the needle point and use the pen.
Oh yeah.
Nice. Beautiful.
I will do the old method.
Yeah, we have to that. Additional beginner training method.
Thank you.
Mhm. Yeah. The system is kind of making it look good, making it easier for the teacher.
For the trainees.
Teacher. Or the attending,
The attending.
or the surgeon. Yeah, that's now you can figure yourself. And this will be your teacher. Oh, this
Oh. Wrong one. That's not.
Okay, now this is a one more and then we start it.
I accidentally.
Oh. Two arms, two arms. Oh, yeah, Paula, I want to talk about the needle direction here. Okay, go the needle. You need a needle. We work together and then you will.
Oh, I did. Oh,
I bend the needle, I hold the needle and then we bend and put together.
Oh, that you corrected. You
Yeah.
fixed
Yeah,
it.
so the most stable way of holding the needle is like this way. See, the needle perpendicular to the needle holder. But that's not always why, because the vessel is, if the vessel is lying in front of us like this direction, from the upper right to the lower left, that's the best way. The best, just pick up a needle and then the needle is lie up with the axis of the vessel. But most of the time, the vessel may be this way. The worst scenario is like this way, or lower left to the upper right, upper left. That's the worst scenario. So most of the time, you need to adjust the needle a little bit. So we want to, like, think about if we holding the needle like this way, once in, it's holding like this here. And then we have to adjust when the needle is already in the vessel, it's hard. So to prevent that, making it easier, we hold the needle parallel to the axis of the vessel. So I see I pivot the needle a little bit, and then also I bring my hand to the center a little bit to come and see that angle. So this is one thing about the needle direction. So in this situation, just in and out, I need to adjust between the.
And the worst thing is just putting a stitch like this, and then you have a hole, you don't know where, yeah.
Yeah. So the second thing about a needle direction is, I want the needle like horizontal to the surface of the vessel. But if I holding too close to the tip, it's falling down. There's a high risk of hitting the backbone. If I holding too close to the tail, like we have to turn a lot to do the pierce. That's not good. So holding the right spot is the needle horizontal to the surface. So you only need to do just press down and forward. And this one, move forward and yeah. So yeah, that's the needle direction. The real really meaning of the needle direction. Okay. See the needle sutures behind you. Yeah. I will fetch the tip of the suture.
So you don't have to do what I did.
Yeah, so the suture will get the short and long inside of it. Yeah, beautiful.
Thank you.
Yeah, good job. And the vessel is even. That's the best. Nice. Awesome. Awesome.
So you have to just the needle. So
Yeah. Yeah. Smallify on this side.
yeah, we don't want it.
Adjust the suture. See, the suture is.
It's not like this.
Yeah, this suture is behind your middle bone.
Yeah, so it needs
So
to
you
be.
feel not comfortable. Yeah. Yeah. Yeah, that's it. Yeah, now this suture is in front of the.
Oh, I see. Yeah, it makes a whole difference.
Yeah. And once you try, you will feel the difference. But if I just tell you, it's hard to understand, right?
Yeah. Stitch left.
Yeah, we can try. Okay, great. So, right, let's bring I prepare a chicken thigh for you so we can use the real vessel.
Oh my god, I feel like I'm not prepared.
Yeah, you what graph do you size do you want?
6.5 or small. Thank you. And this little thing is just silicone.
Yeah.
So soft.
Yeah, that's the I I reach out to the company and then only each company can make it so soft. It's already similar to the human skin. Just the softness in kind of in China they can make.
Oh.
We are in our lab we are making something even softer. But That vessel is made by a machine. It's very efficient, but they cannot use even softer silicone material.
Oh,
Yeah, but it's good. It's still very good for
for
practice.
practice.
So to just make sense of the method.
It's really, really soft. It's nice.
Yeah, and then the suture you can see the suture can tie everything down. Okay, let's dissect the visual now. So usually one set of micro instrument, 3-4 step, uh 3-4 step. Now 2 scissors, 1 needle holder. That's enough. 6 piece is good for 2 surgeons my case.
Okay.
Like 3-4 step. Now in this situation, you use 3-4 step without me, and then I use 1-4 step. That's 3-4 step.
Okay.
And then in this hand, some have scissor, some have straight scissor, some have needle holder. So
Okay.
6 instruments. 6 instruments.
Yeah, I like those first. It's way better than this one. This one I don't like much.
You know the price is there.
Yeah.
They are not.
There, you can feel the price difference in your hands. Let's say that.
They're not kind of quality controlled by a certain interested company. They may design for just like some electronic hair, so they can pick out a tiny screw or something. The scissor is there, scissor and needle holder. The needle holder they can make it the tip a little bit smaller. That is the vessel. So in the micro dissection, also we don't like spread too much because spread is also very hard to control. So what we do is we just push like here, we open a window. When we don't see the vessel, to open a window, we pick up the adventitia, pick up the fat tissue. Don't cut like this way because we don't know how deep we cut. So we will cut like this way to open a window. And then once we see the vessel, we pick up here. And then we push the vessel away, push the vessel away,
And then
push a little bit. Also, we push further, but we cut a little bit less. So every time we push further,
you're kind of
dissect more and cut a little bit less. So every time we cut in the safe space and preserve something, we can move forward. We just push it away. And the sequence, remember the vessel has 4 aspects: top, both side, and underneath. So when we dissect a vessel, no matter a big vessel or small vessel, we need to address all 4 aspects. So just microsurgery, just slow down, and then you cannot skip anything or take a shortcut.
The famous slow is fast.
Yeah.
Microsurgery, you go slow, but that means fast.
Now the top is open. Now we go over both sides. We can hold in the here and then push the vessel away, or we can hold in the vessel and then push the tissue away. After several push, if there's still something to connect, we can use a scissor to cut it. And so only pick up the adventitia. See, after I pick up the adventitia, there's no mark lift left on the vessel. If you pick up like this way, see?
Look at that.
That's not good. So microsurgery, the patents of the anastomosis is it happens before your first stitch. It's all when we're doing the dissection, it's already determined
the success.
Yeah, it's already depending on our success. And even further is the patient management. Line when the patient have enough fluid and coagulation system is working good, more hypercoagulation. That's the way to make a successful microsurgery. It's not just like
It's not,
a
it's not
a
just a
stitch.
technique, yeah,
It's
I
not
mean,
just-
it is technique, but it's just a stitch thing.
When we pay a lot of attention to the other everything, we will achieve pretty high successful rate like 90% or 95%. That's a good microsurgery. And then other than that, 5% of
Unlucky.
lucky is based sometimes it's the patient systematic problem. And now when we get more branch, we can use a suture like here, like this big vessel. Like this small vessel, we just
Oh,
you do our best. Yeah, the pedal is the left.
let's just like.
Yeah, we can use this one to like the pen. So vessel here. Just wrap around.
Said, thank you.
But this vessel is not very small, it's like 1 millimeter.
Yeah,
That's our goal, okay? At the end of the training, we can do 1 millimeter. Maybe graduate.
well, I am very far from graduating. Oh, I actually broke the needle out.
1 millimeter is not very small. I mean, most of the vessel, 1 millimeter, we still can see a woman very well. There's not much difference in technical.
And you have to ligate just one side, or you ligate both usually?
The real vessel, we
Ligate both, but we
yeah,
know that
this side
today it's not gonna be.
yeah, this side we will just pass.
Oh, okay.
In the real vessel, yeah, we want to make sure there's no
No,
vessel
you
open.
I never found those clamps to buy too, but can you, like, where do you usually get, they're definitely not on Amazon. Yeah, those clamps,
Oh. Oh.
like,
Yeah, it's-
the AliExpress maybe?
AliExpress don't have this. They have
Yeah.
something very simple. China didn't make this.
Oh,
This comes from Japan. See that triangle?
oh,
Yeah, triangle. They give us teaching. There's also some different in this training is that it's from Jam company. Holding group. Huh? Yeah, kind of shoot, kind of. There's 3 seasons. Then we cut it. Straight season.
yeah, just, yeah.
Yeah. And then we need to clean the anesthesia and check the imaging. Sometimes it's blurry. Actually, it's good. Not too bad. But sometimes in a high magnification,
It gets blurry.
Oh, when I do the kidney transplant, I use a zoom in and then it's out of focus, so I adjust the camera. But then now we use lower resolution, it's out of focus. It's not as the camera didn't catch it as well as what is
I was
what we see.
previously here.
Okay, now to trimming the adventitia, remember straight scissor, adventitia scissor.
Yeah,
I think
yeah.
about like come here. You cannot do the same way like the textbook said, oh, pull all adventitia away and then just cut in here. So the same thing, we still need to use a dissection scissor. Okay, now I like to use 3 spot. This tripod method. One here, you pick up here and here. Yeah, have you seen the method teach the teacher clean the adventitia? Now, see, this is the adventitia.
Oh.
Yeah, why we want to trim it is we want to prevent it go into the lumen, because sometimes once it get into the lumen, the platelet they you recognize as something from outside, because only outside has this adventitia, so they will attach to it and then develop a process. This side. See if it's hard to cut, I push a little bit. Push a little bit. When we cut this side, try to cut the scissor away, scissor tip away from you. If we cut like this side,
you can cut the vessel.
You may cut into the vessel, and that's the real lesson I learned. You know, I made a lot of mistakes. So everything
I love learning with other people's mistakes.
Yeah. So I when I told you that's the real lesson. I cut into the vessel. And then I have to remove this segment, and then actually we think there's more tension in the
anastomosis.
Yeah, good. Yeah, only pick up the adventitia, so push a little bit and also cut. Scissor is not
the best.
Yeah, keep it low. Keep it low. If we raise it, it's
out of focus.
Yeah.
I think we have the tendency of pushing up just because I don't know.
Okay, now we only have one person, so I would like to push right this way and then use scissor as a stop and then cut like this. That's the way of one person.
Oh.
To trim the t-shirt. See, I push it a little bit and you cut. That will be very, very careful. To cut into the vessel wall.
And here.
So we don't need to trim all the way pretty far. Most of these like 2 millimeter away, because that will spare the clean window pierce point. That's it. Sometimes we trim it very happy and then trim very far. Yeah, because it feels happy and fun.
And then it's like it's coming, so let's do it.
And here I would like to demonstrate the first and second stitch, which is the most
hardest one.
one.
And you take out the strap.
See, here's a scissor. So actually the one you just cut it here.
Oh.
I feel that 10 centimeters very, very convenient. This is 30. Okay, now in here and there, see what I do. Now if we just want to pierce here, it's hard because it's on the left hand side. So what we can do is we put the forceps in there, and then we use the needle to bring it. See this?
Oh, you rotate it a little bit.
Rotate a little bit inside. If you go into the gap, then see with the support and with this open, it's very easy to do that.
Oh.
And I only open the forceps to allow the needle can pass through. And the first and second stage, usually if that's scale, I want to use 2-step. So I take it out and then yes. Now from here, now you want to come out like that way, right?
Yeah.
So we see if I want to do that, my hand will be in a really not comfortable position. So actually I still holding, I didn't change my hand, my right hand too much. I still holding the right the same way. And I open the movement. And then just push a little bit. Now I can find the natural spot. Now it's very important to use our left hand to help. See? Just bring it down a little bit. And yes. Now we can do it. Exit fine. Instead of like pointing away our shoulder and then yes, like
Oh, then you're struggling.
yeah, that's struggling. When when you feeling you can control the needle better and use your left hand better, you can use a very simple method to do that. So now we can secure our vessel. If I didn't put the forceps here or needle holder here, the vessel will come along with as we go in the suture. So I put it here. Now the suture is not straight. If I still keep pulling it, I will worry about here with here this tiny bite. So I will like to release the tail. And then I go. So the goal is we need to make sure this suture pass through the vessel wall straight. So don't pull this way. Pull it this way.
So you're not creating shear.
Yes, the shears, yeah. Shears force is danger. Okay, now we bring it in front of us. And I catch the needle. Put it in here. Now you can see it, but you won't. If I put it too close to here, it will interfere. I'm not. Same thing, we raise the edge a little bit. So the force of the suture can bring these two vessels close and then it match very tight and pass the suture or still pass the suture to figure out this that way. Okay,
Is this
Yeah,
here
sure.
good enough? Shorter?
Yeah, the goal is to don't let this suture interfere your next stage.
Maybe it's too long then.
Yeah, so if you want to cut it better, use your left hand to support. Like you holding your left hand, your needle holder, and use your forceps to holding your scissor, so you can cut it. Yeah. So sometimes when like in the morning we didn't have a good sleep or we have too much coffee, our hand is shaky. You
That's
use
how
your
you-
left hand to support your right hand. It's much better. Then you won't scare the teacher. Okay, like this one is also the same idea. This one we want to pierce here is really hard, right? So what we can do. Needle is also a tool. Use the needle to open the wound.
Oh,
In here, that's that's where we want to go. So I just move it a little bit. That's on the left hand side. And then here, same thing. Holding it. And then just
straight.
yeah. Yeah, I will let you do this one.
Oh,
Yeah. And you can cut this one to then you try hold.
struggling just to catch the, what's wrong with
Yeah. Pass the suture. Pass the instrument from instrument. Pass the needle from instrument to instrument. So I even me. Yeah. Nice. Good job. can push further as far as. With the first second,
Paula. Yeah, you have to use the other hand to stabilize it.
yes.
Gonna have to.
Use your left hand to pull the suture out, and we can use the first three sutures
Oh,
on the left side. If you start with your shoulder like this, less is good. Like this, it's about like 6 or 7 millimeters long.
now I did it the wrong way. It's like, so,
There's nothing right and wrong. It's only your first one. it's good. You can do it. And slowly you have more bandwidth of conviction, and then you can pay, you have bandwidth to pay attention to more
more detail.
details. Don't worry about that as a teacher. And that also making me better in teaching my kids. So yeah, don't worry about it. If you
Oh,
just go to the right way, as the time goes by, that's not a problem at all. Yeah, 3, 4 seconds. So on another. Yes. Push far, yeah. So that longer. You know, when I just start, I just practice pick up the needle at home.
Yeah, that's what I had to
And then
do.
using my root, I pick up the needle and then adjust it to the right direction, and then just pick it up. Practice
Is that-
that
Is that
again and
correct?
again.
Yeah, that's,
Yeah.
it's not, but, yeah, so. To go parallel, that's.
Yeah.
That's over here.
You can always hold it, yeah, so you can find it.
Too big of a bite?
Yeah, a little bit small will be better. Theoretically, the bite size is like twice of the thickness of the vessel wall.
Oh, so even this was a bit too big.
Yeah, a little bit smaller than it will reduce the wrinkle of the edging. Might be including too much of the vessel wall, too big a bite, that it will wrinkle up a lot inside the on the edging, right?
And also like where I put this makes a difference, so. Yeah.
That's right. Okay, they looks right here. They looks here. Come here
Oh.
to they looks. Right. Try again. Try again. Yeah. Yes. Okay. Hold on. Right. If we most of the time this forceps the middle joint, it should be between these two sutures. That's easier. If
Okay.
we come here, that's outside of two suture. It will be harder.
Oh.
Yeah, that's some small thing I can see. Yeah.
That is actually a lot easier.
Yeah. If you go here, you still can remove, but it's not convenient as.
Thank you.
Yeah.
Oh, Paula broke it.
Yeah, it's good. It's good. Sometimes I just told us the rest, okay, try pull it as hard as you can until you break it. You need to make sense how much force
How much force you can break
it. It's good time to break some suture in the
in the practice.
But sometimes we break a 3/0 suture, right? Where we
Yeah.
can't tighten us and something.
Okay,
So
so
this
now
is
it's gonna be like sheet like we have to open. So this is not well. So I need get this in a better position or whatever. Now I have to get like that.
Just go forward. Keep it in the air. Don't need to take it out because now it's very close. Yeah.
And then here. Oh, so it's easier to do one pass.
Yeah, after the first and second stage, one pass is
It's okay.
it's okay because it's very close and it's hard when we take the needle out and then bring it back again. It's hard.
Okay, you know, I see. If I don't have it right. I broke it again.
Yeah, it's fine.
I don't know what I keep doing. I think I'm putting too much pressure.
Yeah, it's fine. Because at the beginning, you don't know how much force and your muscles getting practice and you get used to it. Like if I told you, okay, hold on, relax your finger, but you don't know how to relax. So it's now that's what
That's what happens.
yeah, that's what happened, and that's why the training actually is training our muscle. Now I can relax my muscle. When I don't use my shoulder, I don't use my elbow. But at the beginning, we even need to holding our breath.
That's me.
Right?
I'm holding my breath. That's
Yeah.
exactly what I'm doing.
Yeah, when we doing the stitching, we hold our breath until the needle pass.
You shouldn't be poking in the bag. Should get it for the edge of the vessel, the line of the vessel. Would have saved me. I think I need one more. Yeah.
Three most of the time is good. We don't lose this picture.
Cheers, that cheers makes sense. Oh, I grabbed it. I saw the mark, see? They
Oh.
said it was gonna happen if I grabbed the vessel. And that's how I knew I was grabbing it, not the way I was supposed to be grabbing.
I respect the tissue, and then the tissue will respect you.
I love it. It has to be mutual respect.
Yeah, if you don't respect the tissue, and then at night they will call you back to the OR. That's terrible. Right?
So you didn't respect me, so that's what you get. So see, I try not to get too hard, but then I let it go. So I'm trying to figure out how much pressure I put.
Yes.
There we go.
One more, that's 50. And inside, we have good. We've got all. Inside a little bit, touch on this ankle suture.
Oh, did I get it?
Yeah.
Yeah.
So this one is the last one. Yeah, the last one. And most of the time is this suture, the middle suture most of the time is fine. Mostly it happens on the
Oh, I
last
see.
2 or 3 days.
That was a catch right
Yeah,
here,
from
right?
the suture.
I have to take it out when it's like that.
Yeah, we cannot just cut it. We have to remove the stitch and then
Do it again.
yeah, so like the middle should be fine. So
Yeah.
mostly catch the bear will happen in this suture or this
That's
suture.
suture.
I think about that's the corner. And well,
And
it's the corner. And then here after the middle that's pretty far away. And then corner here. That's closer.
that's the closest part, so it makes more sense that it's easier to catch.
Yeah, I catch the bear was sometimes. And it's always happened on stage. Okay. Yeah.
And then to make sure.
And also is the entry by won't catch the barrel. The exit by will catch the barrel mostly, most of the time. It happened on the exit by.
Probably a little bit of a bigger bite,
Yeah,
but
for barrel. So you can hold this suture, and then you can see when we holding this one, you can the needle can stand up. And you can use the left hand to pull the suture, so you can
Do that, and then you get.
you can make the suture needle stand up. Now after first snap, we can check if we are not very sure or in something like small
So we
vessel,
don't have to.
we cannot see it. We, after the first snap, we can check it. It's worth to spend the time.
Then having to take the.
Yeah, instead of tying all knots and then have to cut it.
Oh, that's really smart. Wow, now I understand all the going on. My needle was stuck. Oh, Paula broke it again. I think I might weaken the like gravity so many times.
Yeah, sometimes that's that also suture damage. It's 2 o'clock. Do you don't have any thing you have to go, right?
I don't.
Okay.
Wow, it's already 2. Time is flying.
Yeah, we don't feel the time, then usually have fun. Like playing games. Do you play video game?
I don't play video games, no, but
I mean, so when you have something fun, you don't feel kind.
do you have anything? You can have anything, just let me know, because I'm.
Oh, we can finish this anastomosis.
Okay. I'm gonna try to use that technique so I don't get.
This one is faster. That one is treating our hand, so it's different purpose.
So you always recommend starting the furthest away from
Yeah, either it's the it's two stitch that's no difference. Yeah, now with this method, you don't have to you skip a lot of struggle or pierce in the vessel. By this just moving forward method. Wait, you tie so fluent.
It's the famous. So don't do it fast, and thinking will take it from you.
That's
So the clock is ticking, and then you're gonna.
yeah, sometimes the nurse, I need to go become a kid.
I feel like I might have back wall here, so I'm gonna come out.
Yeah, slow down and rest your hand on the table. And then you like rest like this. I also rest your hand. If I sometimes if you need support, ask for some towel.
Some
Yeah, some towel to ensure our hand can be just. Let's try this one more time. Like this is an angle.
Oh,
And
I
then we
see.
put a dot here and here. And if we make a dot here, that's means we may need to add one more stitch there. Yeah, let me show you how I do it. The first thing is like the needle to rest. Just both arm in there. If not, you can put one arm. It's fine. One arm is also so best that we move forward. And here, so we keep the needle in the needle on the tip.
Oh,
Pulling up a little bit so that that will stay away from us. Also, like, see, this is a good way to test, examine the backward. So I pull it, that
because
will
you
stay
see,
in there.
yeah.
So we ensure there's no backward on the needle. So here, put on the tip. Now the gravity actually is pulling it down. So the same thing, you want to go back a little bit, just slightly pull the needle a little bit, go back. You can also pull it again, so that was far away from here, from the needle, and this is one. Okay.
Good. That's awesome.
Yeah, it's good to like don't guess in a microsurgery. Don't guess. Like, oh, probably not. I didn't see the catch what that was. Every step, make sure be 100% sure. No error, no mistake. That's the guarantee to you have a high successful. Yeah,
Surgery is straight.
I can push the needle. I can pull the needle away. I can step.
Oh.
When there's no tension, you can just use a regular knot instead of a certain knot. The first and second stitch, usually we need to bring to end.
Because you gotta pull the vessels together, right?
Yeah, so we use certain stuff. It's better.
Oh, that's me again. I have to work on not breaking that.
Great.
So let me put this here. I'll put it here in this little corner here so you don't. Oh, time to see. And do you think this clamp here because it marks the
Oh, that's the there's a clamp. That bumpy thing is all rounded straight, and they on this end and the other end they miss. They don't punch together. They write this way.
Oh, so they don't
They
actually.
don't. It's
create
like
a-
a geometric method.
That is awesome.
They're very well designed.
Thanks for letting me know. That's really cool.
Famous
Time
blue
to
blood.
see. Time to see.
Can make a video.
Oh, can I get a video with my phone?
Yeah.
See. Heck yeah.
Yeah, very good.
There is a little bit of a leak.
That leaking is normal. Yeah, that leaking is like because water can flow out from any tiny space. Why the vessel can stop the blood automatically is because it's life. When the platelet detect there's a leaking, they will attach to there and fix it. Yeah, great. Very good
Awesome.
call. And also, like if there's a small leaking, it's fine because the platelet and fibrinogen will repair it. And but that big leaking, you cannot put a gel foam on the top or try to stop the bleeding from outside because if there's leaking there, big leaking, there's a lot of platelet. You need a lot of platelet
To kind of do it.
fibrinogen to block it. If
Then
the
it
vessel is
clot.
small,
It will clot the vessel.
yeah, we clog the vessel. So when we see a heart is leaking, just put one
Just put one
stitch
more stitch.
to stop it.
Let me get some gloves to help you out there. That was really cool.
Yeah,
And then, so I'm a little bit of leaky. You said it's okay.
yeah, it's okay. It's totally normal, because the vessel, I mean, the water can leak out even there's tiny spot, right? A garden hose, if there's tiny spot, the water can come out because the pressure and something. And it can stop breathing in the human. It's because the fibrinogen got active to fibrin and then catch the platelet together to seal it. Yeah, life. It's
Yeah,
really smart. Our body is way smarter than us.
Oh yeah.
Yeah.
And then, do you mind if I take this in here for a second class?
Yes, yes.
Because I'm gonna keep them.
That's a good idea.
Second class, second lecture.
Yeah, that's a good idea. So we don't just throw it away. It's very kind of
And it's gonna be on my remembering of my lectures.
uh 40, 30,
Today is the
30.
13th.
Yeah, actually, I want to know like how many suture we can help us to be good. That's actually.
Yeah.
We should have a machine or something to kind of.
That's so cool.
Then
Yeah,
two
two
more.
more.
Yeah. I give it to the visiting student. So when they come here and then we give them flower to practice.
Oh,
And then I also make like one of these things to them. So they actually keep it. Some, you know, some of them they match here and they say, I still keep them.
I still keep that. Oh my God, that is cute. I kept mine from about a year ago. In fact, keeping them.
Yeah.
Make a little book of my training.
Yeah. Yes, I don't want.
Yeah. Cool. Yay! Keep it. And then I got all my little sutures saved here.
Yeah. Oh, yeah, let's talk to the camera and then we Paula, switch to the scenes of the phone on the left top right, top left corner.
Oh,
Top
here?
left. Yeah, phone
Uh,
on the left side.
this side you mean?
Left side.
Oh,
Left.
here.
Yes. Phone.
It says drive cam, video cap, file, edit, view, doc, scene, tools, sources, scene.
So many options now.
Yeah.
Oh, scenes here. That's the
Oh,
source.
scenes.
Scene. So phone.
Phone. Oh.
Awesome. Sorry, I didn't.
It's little bit. Hello everyone. So it's very productive today, and we finished. I finished the first anastomosis, and we did two end-to-end anastomosis. As we talk about the end-to-end, there's two method of anastomosis, like the two-stage method, and the other method is the backward first method. Both are very important. The two-stage method can cover like almost 90% of the scenario in the microsurgery. So that's a basic method we need to practice. And other than that, like end to side is just a special end to end. You can translate the technique from today to the different style. When we when our hand getting well trained, it doesn't matter what size of the vessel. Like smaller vessel, we just go to the higher magnification. That's it. There's not much secret there. Yeah. And we're talking about the move forward method. That's the most important skill. Can making the PS of the vessel nice and easy. Yeah. And I can see Paula. Yeah. You're good now. If there's a chance, you can ask for to put some stitch on a real vessel.
Oh, that's sweet.
Yeah. Because you can tie up very well, and then have from the piers of the vessel to tie knots. You can do it every step. So just try,
Yeah.
try and find your make your first successful anastomosis. Okay, yeah. So hold up. What share one or two things today you feel is very helpful for you and also helpful for our audience, our friends.
I think I've learned a lot today, and I think a couple of things that stick with me, like a lot of things stick with me, but saying two things that stick with me today, very important, is just making sure that your needle is correctly in your position before you throw the stitch, because if it is a little bit tilted, you by accident kind of gonna tilt it, and you're gonna get a dot tail, and it is just so easy to, like, as you're getting comfortable, to just not pay attention to that detail and just have the needle a little bit tilted, and then you throw the knot and it's like, yeah, now it's tilted, and now I have a small space here and a big space there. So that was, I think, one of the big things that stuck with me. And then the other thing, and I think because I kept doing it, is breaking the breaking the suture a lot. And I think there's a lot of things going on. First, I think I'm manipulating a lot the string itself, and I think I'm putting a lot of force. So I'm still learning a little bit of how much force, because I feel like if I don't squeeze it long enough, then it just escapes from my needle holder or from my pickup. But if I squeeze it too hard, I end up breaking the thread. So it's just that fine detail of, like, knowing how much force you apply to it. And I can cite a lot of other things.
What you're talking about is a very good point. Yeah, first it's about the needle direction. Yeah, and also the second is even higher level is like relax what other muscle you don't need to use. but it's hard. Like it's hard to at the beginning. I mean, that's the goal. And like when we keep practicing, we slowly we need to understand relax other muscle. We can relax our shoulder, relax our elbow when we don't have to use it, so we can kind of do a surgery like 4 hour, 6 hour, even 8 hour. That happens. Yeah. So, but yeah, that's good. Great. Yeah.
Time flew by the way. So we're here for 2.5 hours
Yeah.
already, and it just feels like it was 15 minutes.
Yes.
So
That means we have fun.
yeah.
Yeah. Hey, great. Yeah. Take a selfie. Use your phone.
Oh yeah, we're gonna do it. Oh, goodness. Let's do this. Oh.
Okay. Great.